So dear students, till now we have discussed that endometriosis is present somewhere. It consists of two distinguishing features: that this endometriosis is not normal tissue, this is abnormal tissue and is having aromatase, and this aromatase produces estrogen, and this estrogen is responsible for the production and proliferation of this endometrial tissue. The second thing is that there is production of prostaglandins, and these prostaglandins create a zone of inflammation surrounding this endometriosis. Now let's start with the morphology of the endometriosis. How will endometriosis look grossly? Grossly, an endometriosis will look like a chocolate cyst, just like a chocolate. Now I'll show you a diagram of gross diagram of an ovary which is having chocolate cyst appearance. This is a gross diagram of an ovary, and you can see the chocolate cyst appearance, and this is known as chocolate cyst appearance of endometriosis. Endometriosis also look like gunpowder appearance. It also has gunpowder appearance in if it is present in ligaments of uterus, somewhere near the ligaments of uterus, it will have gunpowder appearance, like there are some patches and spots of gun. And I will show you this in a diagram that you can see that this endometriosis here, this is present over the uterine ligaments, and you can see this is like gunpowder appearance. So there are two morphological features of endometriosis that are visible grossly. The first one is a chocolate cyst appearance, and second is the gunpowder appearance. I will explain to you people why this appearance happened, why the endometriosis looks like a chocolate cyst. The reason behind this is that if this is the zone of endometriosis, and this endometriosis is present over an ovary, this endometrium, as I told you earlier, is derived from functional layer. This endometriosis is derived from functional layer. Functional layer of the endometrium. That is the endometrium. There are two types. Endometrium is having two layers. One is the basal, another one is functional. And basal normally does not shed, and functional is cyclically shedding and cyclically developing. So as this endometriotic tissue present here is derived from layer functional of the endometrium, so it has cyclical order. A cyclical order. It will develop and will then shed. It will develop and will then shed. And due to the shedding of this layer, there will be collection of blood. There will be collection of blood. And when the blood collects here, this blood will become deoxygenated. So due to this deoxygenation, this blood becomes darker. The second thing which happens to this blood is that as it gets older and older, as the blood gets older, there is breakdown of hemoglobin, and hence there is deposition of hemosiderin. And this hemosiderin gives it a dark brown chocolate-like appearance. This hemosiderin and deoxygenation gives the blood chocolate cyst appearance. Hence, the chocolate cyst appears to us grossly. Now, how will this endometrial tissue looks under a microscope? Under the microscope, you will be able to see two things. Endometrium is composed of glands and the second one, stroma. Glands and stroma. So under the microscope, you will see these two things, glands and stroma. Let's see here. Let's see this diagram. This is a microscopic picture of endometriosis. You can see that glands are present over here, and these glands are surrounded by stroma, and you can also see this region. And what is this? This is blood, and this is blood deposition, and in this blood will then lead to the formation of hemosiderin and then chocolate cyst appearance. At last, I will tell you about the clinical features of endometriosis. Before that, let's rewind. What will we see on morphology? Chocolate cyst and the sand powder appearance, and under the microscope we can see glands and the stroma. Now, what will be the clinical manifestations? So, mostly the endometriosis is in this region, over the ovaries. So it presents mostly as dysmenorrhea and if this